So it's been 57 years that we've had Medicare. And it was 30 years ago, in 1992, that in Florida, we had a program that was known as the Florida Universal Health Care Plan. Okay. The Florida Universal Health Care Plan in 1992 had been introduced by Representative Elaine Gordon, who was at that time a Democrat from North Miami Beach, who was the chairperson of the House Health Committee. The bill was HB1, and there was a sponsor in the Senate who was Senator Eleanor Weinstock from Palm Beach, and who was also the chairperson of the Senate HRS committee. Bless you. Though that bill, HB1 and Senate Bill 532, would do the following, and I'm going to read. So you get a quick idea of what was presented and sponsored by two of the top legislators in Florida at that time. So no employer mandates, no co-payments, no deductibles, a publicly financed system using current governmental, federal, state, local health spending, no new taxes, flat rate affordable premiums paid by individuals and families, a single payer, state administered. So in other words, Florida would administer its program, not-for-profit system, administrative efficiencies in insurance overhead, hospital, nursing home, provider billing, administration, all saved from current health spending at that time of 15%. Efficient, effective cost containment through negotiated fee for service. So the administrative entity in Florida would negotiate, for example, for the services of family physicians with the Academy of Family Practice of Florida, or with the Academy of Internal Medicine of Florida. The other cost containment was that it would develop global operating budgets for hospitals and all other healthcare institutions. So a hospital would get paid a lump sum based for a year annually, based on what services they provided, what was the cost of living in that particular area or region, and that's how they would get paid. There would be no need for any additional billing or any other administrative costs. There was an article that I can't remember exactly when, but it sort of compared the hospitals in the United States, either public or private, and those public or private hospitals in Canada. And in Canada, the administration of those hospitals would take place in basically one room the size of my office that you might see behind me. In the United States, the administration of that hospital would almost be a floor of offices. In addition, you all know that to administer a private practice for a healthcare provider, almost 40% of their revenues go towards administrative costs. So let me continue with what the Universal Health Plan at that time was going to provide. It would provide access to all Floridians to comprehensive health care, inpatient, outpatient, home health, nursing home, skilled and custodial, and prescription medications. It would be a consumer free marketplace where every Floridian would have full choice of their healthcare provider and institution. Healthcare providers were also free as independent entrepreneurs. Basically, you would eliminate all the private and public bureaucracy that now intervenes in clinical decision-making. Did then in 1992, and more so now in 2022. This would reduce our infant mortality rate, would provide high quality care, high quality prenatal care, well baby care, immunizations. You'd have preventive care, wellness care, healthy lifestyle education, prenatal health care. You would have mental health care. You would have physical therapy, rehab. There would be no indigent care, no uncompensated care, and therefore no cost shifting, which goes on all the time, because if you have a hospital, for example, like Jackson Memorial, that has and provides a lot of uncompensated care, because people end up coming to them for services and have no health insurance and have had no access to comprehensive care or any care prior to ending up at their emergency rooms. The cost to make up for that care that's being provided at no revenue is shifted to the people who can pay, and therefore shifted to the rest of the system, whether it's Medicare, whether it's private health insurance, or the people who just pay out of pocket. This program would have provided considerable savings to businesses and who had numbers of employees and had an employee health plan, because they could continue to provide that benefit to their employees, but the cost would be much less than what they're paying then to private health insurance. And finally, there were a number of state programs that could be eliminated. There were, and one of them was the healthcare costs that is included in workers' compensation. And the same healthcare cost that's gone up every year since then. And that would be removed because everybody was getting healthcare. All right, to be brief on the rest of it, in the 2 years that led up to the bill HB 1 and SB 532 being introduced in 1992, we had volunteers all over the state of Florida from every organization that you can imagine, including the Catholic Church, the Diocese of Miami, including AFSCME and all the other unions who were really tremendously productive and helpful in our grassroots activism in providing some of the administrative necessities and the copying and the paperwork. The executive director of our organization, the Florida Healthcare Campaign, was a gentleman by the name of Marshall Litvak out of Miami, a union who basically used his vast knowledge and networking and helped us stay on top of basically everything that was going on. And what was going on in 1992 was that every single substantive committee in the House and in the Senate passed this bill, the House bill and the Senate bill, through every committee with support from Republicans as well as Democrats. Because the people in every one of those legislators' districts were involved in talking, as you are doing in Medicare for All in Florida. But we were frankly very successful. And we were on the floor of both the House and the Senate for final votes. And then we never had a vote. And why didn't we have a vote? Because the Democrat governor of Florida decided that although he had, during the legislative session and during the campaign before that, during the 2 years before that, had been supportive of this Florida Universal Healthcare Plan, telling organizations, senior organizations, community organizations of his support. And then he decided to allow the insurance industry to do the right thing. And they've been doing the right thing to us ever since. So it's not just Republicans who have blocked the development of universal health care for the United States, the only country, as you know, in the developed world that doesn't have universal health care. And you know, there have been Republican presidents like Theodore Roosevelt who actually suggested a universal health plan for the United States. Of course, it didn't go anywhere. Richard Nixon also recommended a universal health plan. It didn't go anywhere. So it's not just Republicans who have been blocking this. It's been basically the control of Congress by big business, by big financial institutions, by big pharma, and by the big insurance companies. And you know the rest of the story. So I think I can stop now. As I said at the start, I will be sending Lorenzo an email that I received from PNHP that outlines the activities that are going to be going on July the 30th to celebrate the 57th anniversary of Medicare. And I'm sure you guys might be interested in participating if you haven't already been contacted. And I'd be happy also to make a copy of this very weathered flyer that we used in 1992 that also talks about all the savings that we would have. And what's also interesting, and my final statement, these cost savings, which were projected by our group, were also, once the bill went to appropriations, in both the Senate and the House, the Senate staff and the House staff did their own financial evaluation and came up with exactly the same findings, the same savings, the same ability to put into effect this program within a year of its adoption. I mean, if you were a dreaming person or somebody who believed in positive dreams, you can dream about 1992 being the passage of a universal health plan for Florida and think about what that would have meant to the rest of this country. I'm happy to listen to your thoughts and take any questions.